Good afternoon and many thanks for joining us on the broadcast this afternoon. It is the 6th day of November 2016. I am Ben Kitili at the KTN News Center here in the Kenyan capital, Nairobi. KTN Newsdesk begins now. The top stories this hour. No solution in sight as the nationwide medical workers strike enters day 2. And no more adjournments of corruption cases. Chief Justice to publish rules on speedy conclusion of graft cases. Interviews for candidates shortlisted for IEBC commissioners continue. Welcome to the program. It is day 2 of the medical practitioners' strike across the country. Several deaths have been confirmed while there have been some premature discharging of patients across the country. We are covering this strike the way only we can. We have Elvis Kosgei, our correspondent in the North Rift, standing by in Eldoret to just give us what is the latest coming from Eldoret, what is coming from the Moi Teaching Referral Hospital, of course, the biggest hospital in that region. We also have Victor Ogale who will be joining us from Kisumu to just give us the latest from there. Let's now begin here in Nairobi, where health officials led by Cabinet Secretary, that is Cleopa Mailoa, are currently meeting doctors' unions officials in a bid to end the strike, which entered the second day today. Officials of the Salaries and Remuneration Commission are also attending the closed-door meeting at Afya House. The meeting comes as public health facilities remain deserted as nurses and doctors keep away. At least 8 patients are reported to have died on Monday, on the first day of the strike. Let's now find out what is happening from the North Rift. Let's talk to Elvis Kosgei joining us live from Eldoret. Elvis, good afternoon. What can you tell us from the second day of the medical workers' strike in the North Rift especially?
Good afternoon, Ben, and actually I'm at the second National Referral Hospital, the Moi Teaching and Referral Hospital. And what we have learned, Ben, is that nurses are still on at the Moi Teaching and Referral Hospital, but doctors have been away since yesterday as the strike enters the second day. Actually, I'm at the renal unit where patients are being attended to by nurses. Actually, we have more than 5 patients inside here. And interestingly, we have patients from Kisumu. We have another one from Kakamega. Then there's another one who came all the way from Kericho just to get the dialysis. I'll just talk to one of the patients who is inside here. Labda atuambie majina yake na umetoka wapi kuja kufanya dialysis.
Nimetoka, jina yangu ni Celestine Ajema. Nimetoka Kakamega County. Nimekuja kufanya dialysis huku kwa sababu Kakamega hospitali imefungwa, hakuna madaktari. Na hakuna hospitali, hakuna private Kakamega ambayo inaofa dialysis. Sasa nimekuja huku kufanya dialysis juu siwezi survive bila dialysis.
Kwa hiyo unadhani labda mgomo wa uguzi imeweza kuathiri? Kama wewe hapa tunaona mko wagonjwa 5. Na hii hospitali labda inabeba capacity ya wagonjwa hawafiki zaidi ya 10. Tukiwa na visa zaidi ya 10 kutoka maeneo mbalimbali. Unaona kwamba wengine kama wewe wanataabika?
Ndio, tunataabika sana. Kwa sababu dialysis haifai tukose kufanya.
Kwa hiyo ungependa labda serikali ifanye nini ili wengine kama waweze kusaidika?
Ningependa serikali isikie kilio cha madaktari, iwape pesa ambazo wanataka ili warudi kazini, watuhudumie.
Ben, that is Celestine, a patient who is here at the renal unit undergoing dialysis. Maybe it's good to talk to one of the doctors who is on strike actually. He's a nephrologist. He deals with kidney ailments. Thank you very much, Mr. Matthew. You doctors have, this is the second day that you guys are on strike. Yeah. And you can see here patients come all the way from Kakamega, Kisumu, Kericho counties to come to be attended at the Moi Teaching Referral Hospital. What's really going on?
So it's quite unfortunate that we had to go on strike for this issue about the CBA. And as you can see, this unit is supposed to be very busy. It's supposed to handle between 10 and 15 patients. But right now, it's only because our nurses are not on strike that services have been going on here. And I think really our patients are suffering. You can see patients from Kakamega. There's a patient from Kericho over there, and there's a patient over there who is from Kisumu. So it's only because critical services have been at bare minimum, and because nurses have been working, that patients have been able to get dialysis. Otherwise, as doctors, we've not been able to offer our services because of the dispute we have with the government.
Okay. This dialysis, do you think it's a critical thing that needs doctors to be around?
Yes, dialysis is a specialized service. It needs doctors. It cannot be done without the supervision of a doctor. But at the moment, I think our nurses have been trying what they can. They've been straining. But before long, I don't think this can be something that can go on for long. So it needs a doctor to be here. It needs specialists to be here to support the nurses, to give orders and to make changes where necessary. And you know, dialysis, emergencies can occur. And if emergencies occur and there's no doctor, it can be really detrimental to the patient.
Ben, let's also talk to Mr. Tito. What's your thoughts on that?
My thoughts is that with the doctors on strike, this is very critical to this country, because in the renal unit we have those on dialysis and those who have had transplant like me, who need the services of the doctors. But without the services of the doctors, nothing can really go on. We are losing lives. And then if we don't get the medication that we need to sustain our donated kidneys, we will not live. And we are urging the government, please negotiate with these doctors and the nurses so that we end this stalemate. Because how many more lives do you want lost so that you might listen to our cries? We are losing lives both on dialysis. We are losing lives for those who have been transplanted. And for the kidney diseases, they have ailments like diabetes and the other related kidneys and heart diseases. They need to be handled by the doctors. Mr. President, please listen to our cry. Don't wait for the numbers, for so many people to die to hear for the cries of the doctors. Attend to it now. We were hearing about Klaifa Mailu saying yesterday that we have postponed the meeting to tomorrow, to today. You need not to postpone the meeting to today because that is the amount of life you're losing. You should have handled it then. Thank you.
Maybe I could talk the nurse in charge here at the renal unit.
Yeah, I'd also like to say that this dispute needs to be attended to urgently, because also, as much as we're working here as nurses, we're working at the bare minimum. We are attending to the patients who come to us, but we still need the doctors
So it means nurses are not on strike here at Moi Teaching and Referral Hospital?
Yeah, in Moi Teaching and Referral Hospital, nurses are on duty. The nurses are not on any strike. We are there on duty, but again, as I said before, we need the doctors to work with us, because some of the patients need the multitasking, so that all other specialties must be there to attend to the patients.
Thank you very much. That is the nurse in charge at the Moi Teaching and Referral Hospital here in Eldoret, Uasin Gishu County. Initially, Ben, you had visited the Uasin Gishu District Hospital, where doctors and nurses were not there to attend to patients. And there are almost 115 health facilities in Uasin Gishu County, including Moiben. We have Huruma Sub-County, Kapseret, Elgon View, and all those places where really this strike is paralyzing the health institutions in Uasin Gishu County, Ben.
Thank you, Elvis. Elvis Koske there, reporting live from the renal unit of the second largest referral hospital in the country, the Moi Teaching and Referral Hospital in Eldoret in the county of Uasin Gishu, where the nurses in that hospital are not on strike, but operating at the bare minimum. Of course, that renal unit is supposed to be very busy, not so much. But it has some patients from other areas apart from Eldoret. The nurses are calling out for some help from the doctors. The patients are crying for help, but the doctors insist this has to be done. Let's now take you to the county of Nyeri, where KTN News reporter Carol Nderi is now standing by to just give us the latest coming from that county on this second day of the doctors and medical workers strike. Carol, what can you tell us from Nyeri?
Good afternoon, though perhaps not a very good afternoon also here in Nyeri County. We are coming to you live from the Nyeri County Referral Hospital. It is a level 5 facility, and that means being a level 5 facility, of course, it caters to patients, so many of them, not just from Nyeri County, but also from its environs. We're talking about the larger central Kenya and the Mount Kenya region at large, Murang'a, Kirinyaga, Laikipia. These are counties that patients do come from these areas to come to this particular facility. And we've managed to get into one of the wards. We are at Ward 6. This is a ward that tends to male patients. And there is nothing happening here. This is a hospital where usually there is a buzz of activity. It is characterized by so many activities, teaming with people, medics, patients, a normal hospital situation, especially coming from a public hospital. But as our cameraman Samson Dege with Clement Masombo, they're just showing you the pictures. Samson, if you could kindly pan to the beds, the mattresses there, Government of Kenya, Ministry of Health. This is a particular ward that caters to male patients. You can imagine at any one time, a normal day in this level 5 hospital, every bed is usually filled with patients who really, really need these services. And as of now, as the beds lie here empty, you can imagine how many patients in different parts of this county and beyond need this particular facility at this time. And if you can just move with me to the next ward as well, kindly, Samson Dege, our cameraman, will just show you exactly what is happening here at the level 5 hospital, county referral hospital, Nyeri County. This door leads to the next ward, and here as well, it's empty, particularly a region that really, really needs to take care of its patients. It being a level 5 hospital, you can see the beds are empty. Presumably this is where the nurses on duty and the doctors on duty sit and, peruse the files, peruse the records to know who needs what at any particular time. I think we can also check the next ward to see if there's anything happening here. And unfortunately, same scenario replicated in this ward, empty beds. As Samson Ndege is showing you, together with Clement Masombo, our cameraman showing you what is happening here at the Nyeri County Referral Hospital. Nothing is happening here. Earlier on, we did manage to talk to relatives who had come to fetch their patients. We managed to talk to one particular lady. We'll show you the pictures later. Mangare, who said that her son has been here for 5 months, and yet now she had to come for him from this facility and take him to a hospital in Muiga, Mary Immaculate. And she says, for the son to have been here for 5 months, you can imagine the financial strain. Now, if they have to move from a public hospital to look for services in a private hospital, how much more, finances will she need to get the treatment for her son in a private facility? And her story is also the story for so many who have come here to the Nyeri Level 5 hospital to get their patients out, because they're getting no help. There are no medics, there are no doctors, there are no nurses. We only saw some students from KMTC, that is the Kenya Medical Training College. We'd also visited various departments of this particular hospital. And right now, yes, we are at the wards, but we'd gone to the casualty department. We only found students from KMTC, and there they told us that they had been there all day doing nothing. There's nobody even to pay the bills. Nobody, this is a situation happening at such a facility, level 5 hospital. So many people need it. And they're just really appealing to the government to expedite this process, to expedite whatever they need to do so as to end this strike, because the truth is that many are suffering. Yes.
Carol,
so we are here, and we'll continue bringing you to speed about what is happening. Yes.
All right, thank you, Carol. Carol Nderi, they're reporting live from Nyeri County Referral Hospital. It is a level 5 facility tending to people from the whole of the county of Nyeri, as well as neighboring counties. We're talking Kirinyaga and Murang'a. Nothing is happening there, as we have spoken, contrary to what is happening at the Moi Teaching and Referral Hospital, where the nurses are not on strike. At the Nyeri County Referral Hospital, nothing is happening. Let's now come back to the capital, Nairobi, where we have been trying to monitor things as talks continue between the Kenya Medical Practitioners, Pharmacists and Dentists Union and the government. Nothing we can, there has seemed to be no strides made in that particular dialogue. Let's talk to Dr. Marcy Corey, joining us live from our City Center studios. And Dr. Marcy, is there any end in sight to this deadlock between the medical workers and the government at all?
Good afternoon, Ben. It seems that the unhealthy stalemate that still persists between the government and the doctors will still continue. Remember, yesterday we had been informed that the meeting that was to start today at 8 a.m. Unfortunately did not kick off, and indications are that the meeting will start at 2 p.m. So we are keenly monitoring that. The doctors said they went to the ministry headquarters and they had been waiting from 8 p.m. until 8 a.m. until now, but there's no indication of a meeting. But from the ministry officials, they tell us the meeting is supposed to kick off at 2. So whether they will be able to unlock the deadlock between 2 and 5 p.m. or before the close of business today, we are yet to see. But we are keeping tabs on that meeting. We have no indication also whether the nurses have had a meeting. From the government side, they say they've been trying to get in touch with the nurses, but they haven't been able to get hold of them. We had to get confirmations of this. But as of now, we know that no meeting has happened today in the morning. So we hope that the meeting will be held in the afternoon, and we can be able, and the government and the health workers that are on strike can be able to unlock the deadlock. Ben.
Dr. Marcy Corey there reporting to us on the latest between on that supposed meeting between the Kenya Medical Practitioners, Pharmacists and Dentists Union and the government, which is yet to kick off. Reporting that it might happen this afternoon. We are keeping tabs on that. Remember, it is day 2 of the medical workers' strike across the country. Not much is happening. A lot of patients have been discharged prematurely. A lot of people going to private health facilities to try and seek medical attention. Some hospitals, like Moi Teaching and Referral Hospital, as we reported earlier, the nurses are not on strike. So at least there is something happening there. Services ongoing at the very bare minimum, so to speak. The doctors, remember, are calling for pay hikes, promotions, and a review of the job groups. That is what they are saying. That is according to the collective bargaining agreement of 2013. They are saying they will continue to down their tools until their issues are dealt with. Let's now take a quick commercial break here on Newsdesk, and when we return, we have more from our news coverage, especially on what's happening in health facilities across the country. We will be back shortly. Stay with us.